Welcome back to all our viewers. Today we are back with another interesting topic and we are going to focus on Tokyo Olympic Games and COVID. How is COVID affecting Tokyo Olympic Games? Since we already know that originally Tokyo Olympic Games was scheduled for the year 2020, but due to surge in the cases of COVID, it has been rescheduled and has started from 23rd of July 2021. So the question that arises here is what COVID measures are being taken for the athletes. The interesting is the fact that international athletes and sports staffs are being tested every day. Athletes don't have to be vaccinated. Also, there is a common assumption from International Olympic Committee. Officials expect around 80% of them will already be. The next question that needs to be answered is, will there be any spectators? The answer to this is no. All the spectators were banned in Tokyo after the state declared emergency on 8th July and continues till 22nd of August. Most of the people have this question in their mind that why were the games not cancelled? The answer is there was a contract between IOC and the host city Tokyo which states that only IOC can cancel the event. Imagine, due to unprecedented times, the cost of Tokyo Olympic Games has increased than ever. It has raised by 294 billion yen to 1.644 trillion yen. Rigorous health measures are in place for Tokyo Olympics. Overseas officials to be tested for the first 3 days with limits on use of public transport and restrictions on sharing food. Athletes are tested daily and they have to leave the Olympic Village within 48 hours of their competition ending. Also, masks are to be worn mandatory. Exceptions are in the case of sleeping, eating and competing. What about vaccines? Getting jabbed is not a requirement, but it is highly encouraged. Also, the anti-COVID rules are same for everyone taking part in the games, whether they are vaccinated or not. Although Tokyo 2020 has organized vaccines for 38,000 officials, including airport staff, local media, volunteers, among others. Now, what happens if there's an infection? The athletes will be tested via antigen saliva test. If they come out to be positive, followed by PCR test, which is more sensitive, they will be isolated or hospitalized with no chance of joining the competition. Now, what if someone gets really sick? Organizers say that they have 7,000 medical staff ready, but the number of beds are limited. So they have pledged to bring additional medical staff. The next important question is everyone insured? Olympic participants coming from overseas are required to have insurance that will cover COVID medical treatment and repatriation, including athletes, team officials. There is a rule book for Olympics which specifies that the insurance must cover the cover of COVID-19. Despite all the taken care risks, impact may not be fully eliminated. It has been warned by Olympic Playbook, which details antivirus measures. Therefore, you agree to attend the Olympic and Paralympic Games, you are going at your own risk. On the other hand, there are also experts which say that COVID risks at the Tokyo Olympic Games are not being managed properly. So we have to be really very careful because the lives are at stake. There are always two sides of the coin in every discussion. My opinion is it is the new normal to live with this pandemic, so why not get jabbed, wear mask, maintain social distance. We all are aware of the fact what this pandemic is capable of doing. Taking calculated risk is okay, and it's high time that we acclimatize ourselves with this new normal life of COVID-19. So going back to the way we were before COVID-19 is not an option. There is a whole lot of opportunities available here. So why not start the process of thinking about a new normal? Yes, it is possible. The new normal may even be a better normal, certainly a different one. The games have already been started and it is going pretty well. And congratulations India for winning a gold medal in weightlifting. That's all from my side.